I'm about to uncover something many people never even think twice about. Yet, it may be sitting just a few feet away from you, tucked quietly inside your medicine cabinet, working against your body in ways you'd never expect. My name is Dr. Michael Kent. After more than 20 years operating on the human heart, I've witnessed something both disturbing and heartbreaking. Individuals who should have been thriving walking into my operating room with severe heart complications caused not by genetics, not by age, not even by lifestyle, but by medications they believed were completely harmless. These weren't exotic prescriptions or rare treatments. I'm talking about the everyday pills most households keep on hand, the painkiller you reached for without hesitation this morning, the indigestion tablet you've been using for years, the cold remedy you bought last week because the pharmacist said it was safe. What I'm about to share contradicts the comforting message we've been fed for decades about these safe medications. Pharmaceutical companies rarely publicize the risks. Many doctors themselves don't recognize the deeper patterns because the connection isn't always obvious. But I've seen the damage over and over, real patients, real hearts, and I can't ignore it anymore. By the time you finish this video, I'll understand the 5 most commonly used medications that may quietly weaken your heart as you age. Why these risks become especially serious after 60 and what protective steps you can take moving forward. This isn't about fear. It's about awareness, the kind of awareness that could genuinely extend your life. So stay with me because what you learn today could reshape the way you look at your medicine shelf forever. Let's begin with the first category, one found in nearly every home across the country. The medications known as nonsteroidal anti-inflammatory drugs, or NSAIDs. You probably recognize names like ibuprofen, naproxen, and diclofenac. These are the pills people rely on for headaches, backaches, arthritis flare-ups. And yes, they do work remarkably well. But what almost no one talks about is how these drugs behave inside an aging body, and why using them regularly after 60 can quietly strain your cardiovascular system far more than you realize. NSAIDs may seem harmless because they've been part of our daily routines for decades, but their impact on the aging heart is far from simple. These medications work by blocking enzymes responsible for triggering inflammation, which is why they offer such fast and reliable relief. But this same mechanism also interferes with crucial protective processes inside your blood vessels and kidneys, processes your heart depends on, especially as you get older. Let me illustrate this with a story that still stays with me. There was a man named Michael, a 72-year-old who loved spending time outdoors. Gardening was his passion, and despite arthritis in his knees, he worked in his yard almost every morning. To keep the pain away, he took an over-the-counter anti-inflammatory pill nearly every day. It was a habit he never questioned. After all, these are medications people take without batting an eye. But one afternoon, while tending to his plants, he felt unusually exhausted. His breaths became shallow, and his ankles swelled dramatically. By the time he reached the emergency room, he was in acute heart failure. Not because his heart suddenly developed a new disease, but because the daily anti-inflammatory pill had quietly put immense strain on his cardiovascular system. You see, NSAIDs cause your body to retain extra salt and water. Imagine your heart as a pump trying to push fluid through pipes that are now overloaded. A younger heart may handle that demand temporarily, but an older heart, one already coping with natural stiffness, mild hypertension, or age-related wear, can become overwhelmed. There's more. These medications can narrow your blood vessels, raising your blood pressure even if it has always been normal. And if you take blood pressure medication, NSAIDs can blunt its effect, allowing your pressure to climb without your knowledge. High-dose ibuprofen and diclofenac carry the greatest risk, but even naproxen, often considered safer, is not risk-free. To make matters worse, ibuprofen can nullify the protective benefits of low-dose aspirin, the very medication many rely on to prevent heart attacks. But the goal isn't to avoid pain relief altogether. It's about choosing wisely and recognizing how your age and medical history change the equation. Speak openly with your doctor. For many people, acetaminophen, topical anti-inflammatory gels, or short-term, low-dose use may be far safer choices. The key is simple: the lowest effective dose for the shortest duration. Now we arrive at the next category of medications, and this one surprises almost everyone because it's marketed as something that protects you. Proton pump inhibitors, PPIs, such as omeprazole, pantoprazole, and lansoprazole are among the most commonly prescribed drugs in the world. Millions of people take them every morning, sometimes for years, often without ever questioning whether they still need them. They are incredibly effective at reducing stomach acid, which is why people rely on them for heartburn, reflux, or to shield their stomach from other drugs like NSAIDs. But inside the body, especially in adults over 60, these medications may create problems no one warned you about. I remember a patient named Helen, a 68-year-old grandmother who had been on omeprazole for chronic reflux. Her symptoms improved so much that she never stopped taking it. She simply assumed it was something she'd use forever. Years later, during a routine exam, her heart rhythm looked irregular. Blood tests revealed the underlying issue. Her magnesium levels were dangerously low. Many people don't realize this, but magnesium acts like a stabilizing force for your heart's electrical system. When magnesium levels drop, the heart's rhythm becomes unpredictable, sometimes irregular enough to cause life-threatening arrhythmias. And what caused Helen's deficiency? Not a rare genetic condition, simply long-term acid suppression. You see, stomach acid doesn't just digest food. It's essential for absorbing key nutrients. When acid levels stay low for months or years, magnesium absorption plummets. But magnesium deficiency isn't the only concern. Several major studies have found a potential link between long-term PPI use and an increased risk of heart attack. The theory is that these drugs may reduce nitric oxide levels, a molecule that helps your blood vessels stay relaxed and flexible. With less nitric oxide, vessels can stiffen, creating the perfect environment for cardiovascular problems to develop. There's also the issue of drug interactions. Omeprazole can weaken the effectiveness of certain heart medications, especially antiplatelet drugs like clopidogrel, which are prescribed after heart attacks to prevent future ones. The troubling part is that PPs were originally intended for short-term use, just a few weeks. But over time, they've become long-term habits, often without medical review. If you've been taking one for months or years, don't panic and don't stop suddenly. Instead, speak with your doctor about whether you still need it, whether the dose can be reduced, or whether alternatives exist. And if long-term use is necessary, regular monitoring of magnesium levels is essential. Let's move on to the third category, one that almost every household keeps on hand: cold and flu decongestants. These are the pills people reach for whenever a stuffy nose makes it difficult to breathe. The problem? The very ingredients that provide fast relief can place serious stress on an aging heart. Medications containing pseudoephedrine or phenylephrine are designed to shrink swollen blood vessels inside the nose. That's why your nose opens up and you suddenly feel like you can breathe again. But these drugs don't limit themselves to your nasal passages. Once swallowed, they travel throughout your bloodstream, tightening blood vessels all over the body, including the ones that your heart depends on to pump efficiently. I treated a patient named Margaret, a 75-year-old retired teacher who came to the hospital after a severe reaction. She had caught a seasonal cold and, thinking nothing of it, picked up an over-the-counter decongestant. By the second day, her heart was racing uncontrollably. She felt faint, dizzy, and her blood pressure spiked to dangerous levels. Her son brought her to the emergency room just in time. The cause? The decongestant she took to simply help her breathe. These drugs are potent vasoconstrictors. When your blood vessels tighten, your heart must push harder against that resistance, similar to trying to force water through a hose that someone is squeezing shut. The pressure skyrockets. On top of that, pseudoephedrine acts as a stimulant. It increases your heart rate and can make your heartbeat irregular. For someone with an already vulnerable cardiovascular system, even a small dose can trigger arrhythmias or severe hypertension. What's even more concerning is that these medications are sold freely over the counter. Because you don't need a prescription, many people assume they're universally safe. But for adults over 60, especially those with high blood pressure, coronary artery disease, or any cardiac history, these medications can be far more dangerous than they appear. In recent years, European health agencies have raised alarms about rare but serious complications involving blood vessel constriction in the brain linked to pseudoephedrine. These findings highlight a simple truth. The effects of these drugs are not limited to your sinuses. They impact your entire circulatory system. The good news is that safer alternatives exist. Saline sprays, humidifiers, warm steam, or steroid nasal sprays that act only locally can provide relief without straining your heart. The key is caution. Don't let temporary congestion become a cardiovascular emergency. Now we've arrived at the final category. And this one is perhaps the most surprising because it is tied to a topic everyone associates with healthy aging: bone strength. For decades, calcium supplements have been promoted as an essential part of preventing fractures and maintaining strong bones. Countless older adults take them daily, often without medical guidance, assuming they are completely safe. But recent research has raised important questions about whether these supplements may pose unexpected risks to the heart, especially when taken in high doses or without proper monitoring. Let me tell you about Linda, a 70-year-old woman who took her bone health seriously. Concerned about osteoporosis, she began taking a strong calcium supplement every day, believing she was doing the right thing. Years later, she suffered a heart attack despite having none of the traditional risk factors. She didn't smoke. Her cholesterol was under control and her blood pressure was normal. Her medical team began reviewing her history in detail, and one thing stood out: the long-term, high-dose calcium supplements she took without supervision. The concern surrounding calcium supplements isn't about the calcium found naturally in foods. Dairy products, leafy greens, nuts, and fortified foods don't seem to carry the same risks. Natural calcium is absorbed slowly and distributed efficiently throughout the body. The issue arises with the concentrated surge created by a supplement. When you swallow a large dose at once, blood calcium levels spike rapidly, and your body may struggle to incorporate the excess into your bones. Instead, some of that calcium can end up in your arteries. Over time, this may contribute to arterial calcification, the hardening and stiffening of the blood vessels, which increases the likelihood of heart attacks. The scientific community is still debating the exact strength of this link. Some studies suggest a modest increase in heart attack risk among supplement users, while others see no clear connection. But the pattern is concerning enough that many cardiologists urge caution. The lesson here is not that calcium is bad, quite the opposite. Your bones absolutely need it. The real message is that supplements should never be started casually. The safest approach is getting calcium primarily from food sources and turning to supplements, only if your doctor determines you truly need them. If supplementation is required, the dosage, timing, and your cardiovascular risk factors must be considered carefully. Today we've explored 5 common types of medications that may quietly impact your heart: anti-inflammatories, acid reducers, decongestants, older antidepressants, and calcium supplements. The goal isn't to create fear, but empowerment. These insights allow you to take a more active role in your health. Any medication, even those sold over the counter, should be used with awareness and professional guidance. Before you take your next pill, ask yourself, do I still need this? Is there a safer alternative? Should this be reviewed with my doctor? Your heart has carried you through every moment of your life. It deserves protection, attention, and informed decisions. Stay proactive, stay curious, and never hesitate to seek clarity about what you put into your body.